some of the other players are coming up too.
Okay, folks, just so you know, here is the speaking order. So we will have Senator Heinrich go first. He will be leaving because he's got a markup that he's got to go to, and then my boss will take over. So it'll go Mr. Botticelli, then you, and then last but definitely not least, the person probably with the most compelling story.
Absolutely. The only person here who can speak about it.
That's absolutely right.
No pressure.
Great.
Okay, I met you at a meeting in Huntington one time.
I did. Wow.
You're not drug czar.
No, I'm not. I'm actually at Boston Medical Center.
I saw that.
And yeah, it's great. So, state and local is where all the action is.
Yeah, West Virginia's barely action.
Oh, no. They want a picture.
Yeah, this is just for a photograph.
No, for Mom. Over here.
Where is she?
Right here.
All right. So I'm going to kick things off and then hand it off. Excellent. Good. Fantastic. I want to thank everybody for being here today. We're actually right in the middle of the defense authorization markup, so I had hoped to be here for the whole event. I'm going to offer my comments and then hand things off to my very capable colleague from Massachusetts. Most of us know that the opioid and heroin epidemic has now become a national crisis, and we know this because we see it in our states and in our communities. Sometimes we see it in our families. I've personally had several friends who have lost family members to this epidemic, and in recent years, drug overdoses have become the leading cause of death for Americans under 50. I think that's an incredible statistic. Last week, we learned that 1.3 million Americans needed hospital care, either inpatient or emergency room, for opioid-related issues over the last calendar year alone. And like many of the senators up here, my home state has been just seen far too many of these overdose cases. Too many New Mexico families have lost loved ones. Many more are struggling to find treatment and recovery resources for a father or a mother, a son, a daughter, or themselves. And it's clear that our communities need more resources to provide comprehensive treatment and rehabilitation, not fewer. A large part of the funding equation for states trying to confront this public health crisis comes directly from the Medicaid program. And that is what we're concerned about, because that is what will be dismantled by this Republican Senate health care bill. I recently got a chance to visit the Endorphin Power Company in Albuquerque, New Mexico. They are a transitional housing facility for people experiencing homelessness as a result of substance abuse. I met with first responders who are on the front lines of confronting this epidemic. Before we passed the ACA, law enforcement were the first to tell us that our healthcare system was failing people who needed mental health services and substance abuse treatment. Someone with a behavioral health problem was far more likely to be sent to an emergency room or even a jail cell than to get access to evidence-based care. Today, because of the mental health parity law and because of Medicaid expansion, affordable evidence-based treatment is more available to those who need it. A lot more must be done, but the massive Medicaid cuts and the waivers for essential benefits in the Republican bill would reverse many of the gains that we have made in states over the last few years. And it's important to say that grant dollars will not fix the devastating blow that defunding Medicaid would have on our treatment options. You wouldn't treat cancer with a grant, and we shouldn't be reliant on grants to treat the epidemic of opioid abuse in our country. Last year, I also got a chance to tour treatment centers up in Rio Arriba County to hear directly from people who have recovered from the trials of opioid addiction. In New Mexico, Medicaid pays for 30% of opioid medication-assisted treatment, 30%. This is the evidence-based treatment that we know for a fact is helping people lead productive lives again. In states like West Virginia, Ohio, Kentucky, Medicaid pays for nearly half of those treatments. If Congress passes this devastating funding cuts to Medicaid, like the ones, treatment centers like the ones I had a chance to visit in northern New Mexico will be devastated. That would spell an end to any progress that we've made so far in fighting our nation's opioid and heroin epidemic. President Trump knows this crisis is tearing apart American families. He promised on the campaign trail to end this epidemic, but even members of his own White House Commission on Combating Drug Addiction and the Opioid Crisis told his top advisors this month that Medicaid is the leading national payer for addiction and mental health treatment. Majority Leader McConnell knows that his own state, home state of Kentucky, desperately needs the funding from Medicaid to address the opioid crisis. And the same can be said for many Republican senators who have seen this epidemic shatter communities in their states. It is nothing short of hypocrisy for them to say that they are taking this American public health crisis seriously when they're pushing through a bill that will slash Medicaid funding by hundreds of billions of dollars. No amount of grant funding that the majority leader, President Trump, can point to is going to make up for those kinds of cuts. I sincerely hope that enough of my Republican colleagues hit the pause button this week to take a look at what's actually in this disastrous bill. Maybe then we'll start to understand how devastating this will be for the communities that they represent, and maybe then we can get down to the hard work of solving the problems in healthcare that we all recognize do exist. I want to thank you all for being here on this incredibly important topic that's so close to many of us. Senator, thank you.
Great. Thank you, Senator Heinrich. We're going to hear from Senator Menendez, Senator Klobuchar, Senator Manchin, Senator Murphy, Senator Blumenthal, and Senator Hassan. I've also invited here to speak today Michael Botticelli from the Grayken Center in Massachusetts. He just left the job in the Obama administration of running the program to deal with all of these issues, as well as Dr. John Aldis and Shelby from the state of West Virginia, Senator Manchin's constituents. We all know that the opioid epidemic is an equal opportunity destroyer. It has ruined lives of men and women from Lexington, Massachusetts to Lexington, Kentucky. And I thank our guests from these states for being here with us today. I will start my remarks with a simple statement. This Senate Republican health care bill would be a death sentence for those patients suffering from opioid addiction. All the bipartisan progress we have made on combating this crisis will be thrown out the window if Senate Republicans repeal and replace the Affordable Care Act with their cruel and inhumane and immoral legislation. The legislation the Senate Republicans have introduced, we now know will rip coverage away from 22 million Americans. It will eviscerate Medicaid to the tune of $772 billion. And by ending Medicaid as we know it and gutting consumer protections in the private health insurance market, Trump Care will shift billions of dollars in cost for substance use services onto the states and the families that suffer from this disease. For individuals suffering from substance use disorders, repealing the Affordable Care Act isn't about repealing a health care law. It's about repealing hope that all of these families have, that they will gain access to the treatment which they need for this disease. Medicaid is the largest payer of substance use disorders in the country. It covers about 1/3 of Americans with an opioid use disorder and pays for nearly half of the medication-assisted treatment in Massachusetts. Those of us from states hardest hit by the plague of opioid use disorders hear time and time again how Medicaid coverage of these services saves lives. To make up for these draconian cuts to Medicaid, the Senate Republican healthcare legislation creates an opioid fund of $2 billion for 2018. Now, compare that to the $91 billion in funding for opioid use disorder treatment that would be provided by the Affordable Care Act over the next 10 years. That's $2 billion opioid fund as chump change for a crisis that took 2,000 lives just last year in Massachusetts, 33,000 lives across the country. And if people were dying at the same rate as they are dying in Massachusetts, 100,000 people would have died last year. The answer is prevention. The answer is treatment. Those programs will be slashed by the Republican health care bill. Medicaid is a lifeline away from patients suffering from the illnesses of addiction, and this bill flatlines the Medicaid program. And if this bill becomes law, there is no reviving Medicaid. Once it's cut by this legislation, it is dead. It's unfortunate that Republicans who have touted our progress on opioid issues aren't standing up to the policies in Trump Care that would negate their hard work, but by supporting this, they are betraying the families and communities which have suffered from the relentless grip of substance use disorders. The passage of this bill will make GOP stands for gutting overdose protections. We know a vote for Trump Care is a vote to perpetuate overdose deaths. Passing this bill will just be aiding and abetting one of public health's most wanted and most notorious serial killers. In fact, it will take the money that is cut for opioid treatment and protections and then package all the money that's saved as tax breaks that will go to the wealthiest people in our country, including the pharmaceutical company executives who profited over the creation of this problem back in the 1990s and into the beginning of this century. So let me now turn and recognize Senator, the great senator from the state of New Jersey, Bob Menendez.
Thank you, Senator Markey. I'm not as tall as you, so I have to bring this down. Let me say that I'm proud to be here with my colleagues. I wish we were here for a different purpose. But standing up for the core principle that in America, everyone deserves access to quality, affordable health care, I think is a value that we share as Americans. And as someone who sat on the Senate Finance Committee when we were making the Affordable Care Act become a reality, we knew that it wasn't a perfect bill. We know that there are things that we can do to improve it. But every time we have tried to improve it, open up the patient to heal it, our colleagues have sought to slay it. And that's the fundamental problem that we have here, that we cannot get Republicans to join us in an effort to improve health care, but not to slay the very essence of what means so significant coverage to so many people. It's no exaggeration, therefore, to say that Republicans have put this country on a crash course that will endanger American lives and will threaten the financial security of millions upon millions of families. If President Trump thought the House bill was mean, well, this Senate bill is downright nasty. Page by page, their plan asks Americans to pay more for less. It kicks $22 million off of health care insurance. It ends the Medicaid expansion that extended coverage to over 500,000 New Jerseyans alone. And it is especially cruel to the millions of families across America struggling with the scourge of addiction. According to the CDC, over 1,454 New Jerseyans died of opioid overdoses in 2015. The most recent data we have, I know that number is even greater because I've heard from these families as I have traveled across the state. Nationwide, nearly 2 million people remain addicted to prescription opioids, and another 591,000 addicted to heroin. And I cannot for the life of me understand how Republican colleagues can reconcile. I listened to them on the Senate floor, and I was applauding them, passionately talking about the scourge of opioid addiction in our country. But you can't speak with passion and sometimes with tears about that and then vote for this. You can't do that. It rings really hollow. And so ending Medicaid expansion and Medicaid as we know it, beyond Medicaid expansion, that is saving so many lives, is just really, for many people, going to be a death sentence. Every day I hear from New Jerseyans who credit Medicaid expansion with turning their lives around. Just this past Friday, I met with a constituent named Alton Robinson from Rockaway in Morris County, New Jersey. He told me that after nearly 2 decades of struggling with addiction, it was Medicaid expansion that saved his life. It allowed him to get the substance abuse treatment and the physical and mental health care he needed to beat his addiction. Today, Alton is clean. His life is on track. And an incredible part of that is that he is spending his working days helping other New Jerseyans get on the path to recovery. Since last August alone, he's helped 264 people help to beat their addiction, the vast majority of them relying on Medicaid for paying for their care. But under the Republican health plan, New Jersey will lose at least $30 billion in Medicaid funding over the next decade. And the $2 billion they set aside, as Senator Markey said, to fight the national opioid crisis next year is an insult to every community battling this epidemic. Not only the amount, but that's a one-time, one-year amount. The opioid crisis is unfortunately going to be with us far beyond 1 year. And what would my Republican colleagues say to the parents who reached out to me in recent weeks, fearing for their children's lives? What would they say to Irene, the mother in Oakhurst, New Jersey, who wrote me last week to say, quote, "My daughter is a recovering drug addict on the Medicaid program which pays for mental health care and services. She's part of the opioid epidemic that has taken the lives of so many young people like her. She's been for almost a year. Taking money from this program would be disastrous not only for her, but for so many people who cannot afford any other health care." Now, apparently the Republican answer to recovering addicts like Alton and to caring parents like Irene is, you're on your own. President Trump said he wanted a health care bill with heart, but this Senate Republican effort and the hope to try to pass this bill has no heart. It's about as heartless as you can get. Sold out our healthcare system to a bunch of millionaires and health insurance executives, and all of us will pay the price. We'll see that price in our We'll see that price in torn families. We'll see that price in the growing movement towards heroin, cheaper than the opioid prescription drugs. The consequences just in that one dimension is more than we should allow to happen under any set of circumstances. Should Republicans pass this bill, millions of Americans will be denied access to life-saving treatment. In other words, more people will die. And as far as we're concerned, not on our watch. With that, let me introduce the senior senator from Minnesota, Amy Klobuchar.
Thank you, Bob. So Minnesota lost a favorite son to opioid addiction. But what's under that story are all of the many people whose lives were lost that weren't famous. The mom in Duluth, the star swimmer from the farmlands. In America today, 50 people die every day from opioid overdoses. 50 people. That's classrooms of people every single day. And I was so proud to work with my Republican colleagues. 4 of us came together and worked on that bill, the CARA bill, that set the framework for our nation, that we were finally going to do something about opioid abuse. And we got that passed. And we got it done, and then we punctuated it with the funding that was passed at the end of the year in the Cures Act. I was there when President Obama and with President Biden at his side signed those bills into law. Another proud moment. But our friends on the other side of the aisle have to understand these bills in commercials. They can't just use these bills in campaign ads and in brochures. They have to put their money where their mouth. And this time, they have moved backwards. This bill moved us backwards. Why? Yes, it puts some money into opioid treatment, but as my colleagues has pointed out, that is nothing in comparison to what you see with the Medicaid cuts. In my state, 32% of people that get treatment for opioid addiction get it through Medicaid. So when they make these mean, to use the president's words, and by the way, the president is incredibly blunt, right? He has a way with words, and he didn't need a focus group or a poll to get the right word here. Mean. That's what this bill is. But with these mean cuts, basically it sets us backward. And for those 32% of people that get the treatment, they're the ones that won't get the treatment. I'm standing next to here with Senator Manchin, who has a very good bill that I'm proud to be a co-sponsor of, the Lifeboat Bill, which helps to fund opioid treatment. And it funds it by putting a percentage fee on the production of opioid, the percentage of opioid, the product, the milligrams that are in opioid pills. That's one way to fund it. But they don't have any creative ideas here in this bill to help us. Instead, it is simply a tax cut. It is a transfer of wealth from our seniors, from those that need health care, from our addicts, to the wealthiest Americans. So I ask our colleagues to step back, to abandon this bill, and to basically step back and work with us on improvements. There are tons of ideas, like Joe's, to help fund addiction treatment. I have a bunch of bills to bring down costs of prescription drugs, including Medicare Part D negotiations and bringing in less expensive generics. There are things that we can do here, but that's not what's in this bill.
Well, to all my colleagues, I want to thank them so much. It's a shame that we're standing here just with Democrats. We should have Democrats and Republicans standing here because this is a disease, an addiction that basically crosses all aisles. It doesn't have any home. It's not conservative, it's not liberal, it's not Democrat or Republican. It's a silent killer. I'm here with 2 West Virginians who are going to put real faces and situations to an epidemic that we have. We'll have Dr. John Aldis is with us, and he'll be speaking a little bit later. And then we have a brave young lady here, Shelby, who's going to tell her struggles and basically how she's overcoming and fighting through this and to be another productive citizen for the state of West Virginia. I have said this, in my state, we're the number 1. We're ground zero. We have more people that have been affected through legal drugs, opiate addiction, than any other form that we've ever had hit our state. I look around the room and see some of us that might be of the same vintage. We didn't grow up with this. It was not out there. The legal pharmaceutical manufacturers were not producing this product. This came of age in the 80s. And when it came of age, it became a business model. I understand there was some good intentions and some need of really some severe cases we have with cancer and end-of-life comfort. This thing became a business, and it has been exploited to the extent that we've never seen before. This would be a pandemic in any other sense of the word, and we have put all of our forces to trying to fight pandemics and epidemics. So the lifeboat bill that Amy talked about, everyone kept telling me, we just don't have any money. Don't have any money. We can't fund it. We can't fight it. We don't know what to do. I have a cousin who's a federal judge. He said, Joe, I sentence people every day. Every day I sentence people. I've never had anybody turn me down when I wanted to put a person in jail. They found a jail cell. He says, I've recommended now that there's people that should be getting treatment and back into the workforce because they have an illness. He says, if I get turned down once, I get turned down 10 times a day. Sorry, no treatment centers. And then if I go and talk, and I think we just talked about the CARE bill. It was a great bill. It had a really good optics to it. It had no money, no teeth to it. Couldn't do anything. So I said, okay, we have a cigarette tax. We have an alcohol tax. We're trying to fight these types of abuses, if you will. Can't we have 1 penny per milligram, 1 penny per milligram to the manufacturers, the pharmaceutical industry, 1 penny per milligram for every opiate you produce and sell in America? Now, we excluded all those people that have severe near life or end of life needs for this, but just opiates only. That would produce $1.5 to $2 billion a year. I can't get one of my fellow colleagues on the Republican side to sign up. They think it's a new tax. I said, I'll stand beside you and campaign with you. I'll go out and campaign. But there's not a Republican who will vote against you to try to save their child or someone in their family. This is not politics. It should not be political. It's a shame that we've gotten down to what we've gotten down to here. Just in West Virginia, I'll give you a few examples. 129,000. Mind you, we have a state of about a little over 1.8 million people. 129,000 West Virginians had abused or were dependent on illicit drugs or alcohol in 2013. Just a few years ago, 25% of West Virginians who went to the hospital for substance use or their mental health did not have health insurance. After the expanded Medicaid, which we expanded in the state of West Virginia, we're down, this was in 2014, to only 5%. What am I going to tell the other 20? What do I say? I'm so sorry it's going to stop. They referred to the bill, and I agree with President Trump. He said the House bill didn't have a heart. Well, Mr. President, if the House bill didn't have a heart, the Senate bill doesn't have a soul. It truly doesn't, when you think about it. I mean, there's got to be some compassion and empathy somewhere. We expanded health care to 20 million people. We know we can do better by giving them instructions how they can use it in a healthier lifestyle and get themselves back in the productive life cycle, if you would. I'll finish with this. Shelby's going to put a person who's gone through this herself, for her to be this brave to stand, because it's been silent up until now. But Shelby of West Virginia is coming forward and telling their story and how they're trying to. And what she'll tell you, take the Medicaid away, and where is she? Take the Medicaid. And she'll tell you where she's going to end up. And we're not going to let that happen. So that's why we brought real people here and put real faces. I'm fallen in my state of West Virginia below 50% of the working adults working. We have a reputation in West Virginia to have the hardest working people you've ever met. They'll give you more of a day's work for a day's pay than any place in the world, and I believe it, and I've seen it. I just don't have enough. I've lost too many. How do I get them back? There better be some compassion. There better be some way to get them back into the cycle of life that can help us all. So with that, I want to say thank you for you all caring, but thank to my colleagues for keeping this alive. We're not making this political. I'm not chastising my Republican colleagues. I'm just asking them to get a soul, to get a heart and soul in this piece of legislation. That's all we're asking for. And with that, I'm going to turn it over to my good friend, Senator Richard Blumenthal from Connecticut.
Thank you. Thanks to Joe Manchin for his tireless work on this issue, and my other colleagues, particularly Senator Markey, for bringing us together today. I want to introduce you to Sean. Sean is standing here with me a couple of months ago, at an event we organized in our state capital in Hartford to call attention to exactly this problem, the need for treatment and the effects of the House bill at that time in depriving people of treatment. Sean was in recovery at the time of this picture. I first met him at the McCall Center where he went for treatment, and he was doing very well until he had to undergo a hernia operation and interrupt the medication that he was taking, shots of vitriol, for his recovery. After he took that medication, Sean relapsed. He overdosed. He died. Sean could not come to the emergency field hearing that I conducted on Monday, a week ago yesterday, because he was buried just about a week before. But in his stead, Maria Skinner, who heads the McCall Center, came and talked about Sean. She talked about Frank. She talked about the other people who similarly went through recovery. Sean is dead, but Sean is still with us today. Sean is in your family. He is in the place you work. He's in your community. Although you may deny it, a lot of people are in denial. Sean is someone you know, and probably someone close to you, because we are all touched by this problem. We are all part of it. And it is an epidemic that is ravaging every community. No part of the country, no community, none of us is immune from it. So this issue should be one that brings us together. When people say to me, can't you guys get something done? Can't you work together? This is the issue that offers the potential in healthcare for a truly common cause. And yet, it now divides us. What is more sad for our nation? What is really more tragic? Joe mentioned that prisons are always available. I know that as a prosecutor. I was a federal prosecutor. There's always a prison cell for someone who's sentenced. It costs more to incarcerate those federal prisoners than it does to treat an individual and enable them to recover. There is something deeply and fundamentally wrong with this system. Let me just close by saying at these field hearings, a woman came to testify and she said, you know, this Republican plan is not a health care plan. It is a wealth care plan. It is indeed not a health care plan. It's a tax cut. It's a transfer of wealth. And it takes away from people like Sean, who are on the verge of leading productive lives or could lead productive lives and will lead productive lives if they get the treatment they need. Their addiction is a disease. It is a substance use disorder. It is a disease, not a moral failing. What is a moral failing is this bill. What is a moral failing is ignoring the opportunity we have and the obligation to address this problem. And I'm proud to stand here with my colleagues and introduce Chris Murphy, my colleague from Connecticut.
Thank you very much, Dick. I just want to outline for you the cascading horror of this piece of legislation for people with addiction. Let's start with an individual who was able to rely on private insurance in order to deal with their addiction. Under this bill, perhaps the majority of states will pass laws allowing insurance companies to remove the requirement that insurance plans cover addiction. And so that means for millions of people with addiction, they are going to re-enroll for insurance and find out that they can't find a plan that covers insurance. And so then they will go to their next option, which might be Medicaid, and find that states have dramatically rolled back Medicaid eligibility because of $700 billion worth of cuts from the federal government. So they will go without insurance, eventually finding themselves in crisis, putting them in an emergency room. First, they will find that there are less emergency rooms than there were before this bill's passage, because the monstrous cuts to Medicaid will cause rural hospitals in particular to just shut their doors. And so if you get to the point where your only refuge is an emergency room, there will be less to find. But even if you get there, you will look around and find the waiting room just crammed with 3 times as many people as you would find today. Why? Because there will be 23 million of people who won't have insurance, 15 million off the bat. They won't just be people with addiction. There'll be people with mental illness. There'll be people with cancer. There'll be people with other chronic diseases, and they will all be sitting in the emergency room because they have nowhere else to go. The compounding, cascading horror for people with addictions is an atrocity. And the reason why, to me, there is evil in this bill is because, I could hear an argument about this country just not being able to afford care for these people, that our deficits are too high, we have to pay down the deficits. But that's not what this bill does. I could listen to an argument from Republicans who say the way that we're covering people with addiction today through these exchanges, through Medicaid expansion, it's not the right way, so I want to insure them through a different way. But that's not what this bill does. What this bill does is to take insurance, take access to the healthcare system from people who are suffering from addiction, pool that money that we used to spend on their care, and give it to people making over $200,000 a year, to insurance companies and drug companies. That's what this bill does. And I think my colleagues and I call it like we see it. There's evil in that. There is evil in taking money from people with addiction and handing that same dollar bill to a millionaire or a billionaire who doesn't need it. And so that's why we're going to fight this. That's why some of our Republican colleagues are seeing that inherent evil, seeing that risk for people with addiction, and starting to question the wisdom of moving forward on this piece of legislation. It feels today like we're a little bit closer to forcing a very different conversation about how we fix what still ails our healthcare system. And I appreciate all the great work my colleagues have done to make that case. Let me introduce you to someone who's been a leader at every level of government fighting this opioid scourge, Senator Maggie Hassan.
Well, thank you, Senator Murphy, and to all of my colleagues, and to the non-senators who are here. We are eager to hear from you as well. And I just want to take a minute to thank every person in my home state and around the country who has addiction, who has a family member with addiction, who treats somebody with addiction, who has been standing up and telling their stories and speaking about what their lives are like and what matters to them, and why this Senate Republican version of Trump Care will be devastating to them and their families and their communities. This week, Senate Republicans are attempting to push through Trump Care, a dangerous bill that would harm millions of Americans, and, as you have heard, would hurt our efforts to combat the heroin, fentanyl, and opioid crisis, which in New Hampshire is our most pressing public health and public safety challenge. As governor, I worked to pass and then to reauthorize New Hampshire's bipartisan Medicaid expansion plan. Right now, that plan is providing health care coverage to over 50,000 hardworking Granite Staters. It includes coverage for substance use disorder services. And because of the success of the substance use disorder services in Medicaid expansion, those substance use disorder services are now included in our traditional Medicaid program as well. These services have been critical for so many Granite Staters, including one who attended an emergency field hearing I held with Senator Shaheen in Concord just last Friday, 2 o'clock on a Friday afternoon in the summer, and hundreds of people showed up, and over 50 people told their personal stories about the importance of health care, of Medicaid expansion, of regular Medicaid to them. I want to read what Ariel from Rochester, New Hampshire, told us at the hearing. She said, and this is her quote, "I am a mother of 3 children and I have substance abuse disorder. I come from a long line of women who never had much opportunity. With the opportunity to have Medicaid, I've been given the chance of treatment. Without the chance of treatment, I wouldn't have been taught that there is a solution and a way to live a full, beautiful life as a woman in recovery, as a mother of 3 beautiful children, as a woman of dignity and grace. If the opportunity of Medicaid is taken away, the chance of positive change in this world is going to drastically drop. Women like me may never know a world outside of drug use and hopelessness. Today, because of the opportunity of change, I'm able to be a positive role model to my children and, most importantly, our future." Well, when we actually met Ariel, she was still pregnant with that 3rd child. We asked her when the baby was due, and she said, I'm a couple of days overdue. She apparently went into labor immediately following the field hearing. And she told us over the weekend the baby arrived safely, a baby boy. And she said, and this again is her quote, that she, quote, needed to have the baby before Medicaid was taken away. What a thought. Trump Care ends Medicaid expansion. Experts have told us again and again that it is the most important tool to combating the heroin and opioid epidemic, and it would take away the services that countless people like Ariel need. Additionally, this plan also changes Medicaid, traditional Medicaid, into the per capita cap system that you have all heard about, which is just code language for massive cuts that would force states to choose between slashing benefits, reducing the number of people who can get care, or both. Under Trump Care, states will be faced with cutting services that people who experience disabilities, seniors in our nursing homes, and children in my home state of New Hampshire, a relatively wealthy state, 30% of the children get coverage through Medicaid. Republicans have added opioid grant funding in this bill to try to distract from the devastating impact that slashing Medicaid would have on our efforts to combat this crisis. The funding proposed is just a drop in the bucket, and it wouldn't come close to making up for the damage that massive cuts to Medicaid would have. More funding to combat this crisis is something we need to do in addition to Medicaid funding, not at the expense of it. And those suffering from substance use disorders often have a number of other health problems, some of which drive their disorder. If you had a workplace injury and you couldn't get physical therapy for it, but you could get opioids, that may be one reason you became addicted. If you have a behavioral health challenge for which there was no treatment, that may become one of the reasons you get addicted. So to suggest that we'll have this siloed small amount of money for opioid treatment without having an integrated healthcare system that is available to people whose underlying health conditions are part of the reason they have substance use disorder is absurd. So I'll continue working with all of my colleagues to defeat this dangerous bill that would pull us backward. With a vote expected on Thursday, the clock is truly ticking. People in my state have been so brave. They have come forward and talked about their most personal, difficult, challenging experience. They have laid themselves bare before the rest of us so that we could understand that this is a disease, that it affects everybody in all walks of life, and that if we are not committed to a healthcare system for which every American, citizens in a democracy, have access, then we are not doing our job as a democracy at all. We need to defend what we have. We need to improve what we have. We need to come together and make sure that health care is truly available to every one of us so that we can be healthy, productive, and lead together. Thank you very much. Now it is my honor to introduce Michael Botticelli, a true leader. No, we're going to introduce Sheldon Whitehouse.
Thanks, Maggie.
First, sorry.
Thank you, everybody. The number that I want to leave you all with is 270. 270 fatalities just in Rhode Island